Good morning, and thank you all for joining us today. Before I turn it over to Dr. Fitzgerald for an update, I just want to take a moment to provide an update of my own on changes to visitation in healthcare facilities, long-term care and private personal care homes, as well as the community care home sector. So effective Friday, March the 4th, each patient or resident can have 2 visitors at a time, and these individuals do not have to be the same 2 support persons or visitors. In effect, patients can then have multiple visitors and support individuals, but only 2 at the bedside or in the room at the same time. This is the next step in easing restrictions on visitation, and further steps will be taken as we assess the epidemiology and the impact of the increased traffic in our facilities. It is a step once more towards a new normal. In terms, however, of our healthcare facilities, mask wearing will remain in place as we're still dealing with an airborne infectious disease that is prevalent across the communities of our province. Masks will be mandatory for staff and visitors in all our HA facilities and personal care homes. We will continue to strongly recommend that everyone wears masks. With respect to the changes that are coming on the 14th of March, we know that people are reacting to the new epidemiology at their own pace, and each of us is going to find our comfort level at different times. And while we are lifting mandatory restrictions, it is no way condoning abandoning good public health practices. And right back at the beginning, and every so often, we've taken the opportunity to refresh these about hand washing, about physical distancing, and about staying home when sick. Mask wearing, as I've said, will remain strongly recommended. With reference to the NL Vax Pass, we've heard some concerns about the changes that are coming. But I think it's useful to look back and say, well, why did we put it there in the first place? And really, one of the goals, and our main goal towards the end, was to increase our vaccination rates, particularly for those people who wanted to expand their activities beyond the essential. This province has stepped up, and we lead Canada with our vaccination rates in excess of 90%. And I would argue that we are, if not the best, certainly among the best globally. We're still having to live with the virus, and we still are not quite yet there for business fully as usual. So when you do, if you do have occasion to visit our healthcare facilities, we just need to remember that the people in there are our most vulnerable, and we have to take that little bit of extra effort again as we move to our new normal. So having said that, I'll turn things over to Dr. Fitzgerald for an update. Thank you.
Thank you, Minister. Good morning, everyone. I'll start with an update. There are 15 people hospitalized due to COVID-19 severity, and there have been 197 new recoveries, leaving 2,506 active cases in the province. Since the last update, we are reporting 389 new confirmed cases of COVID-19 in the province. 270 are in Eastern Health, 77 in Central Health, 38 in Western Health, and 4 in Lab-Grenville Health. 1,013 tests were completed since yesterday. While we are seeing a small upward trend in active cases, hospitalizations remain stable. The majority of people hospitalized with Omicron require less care and intervention than those admitted due to previous variants. The most recent forecast from the Public Health Agency of Canada projects an increase in cases in Canada with provinces reopening, but with a lower impact on hospitalizations. This is because of the growing level of population immunity through both vaccinations and infection. That being said, infection does not replace the need for vaccination. Vaccinations offer added protection from severe disease. A COVID reinfection is more likely in those that are not fully vaccinated, and over 80% of children aged 5 to 11 have had a first dose, and almost 52% have had a second dose. This means that about 17,000 children in our province are eligible for the vaccine, but not yet fully vaccinated. If your child has had a COVID-19 infection, they should still be vaccinated with the full 2-dose series. After a recent infection, they are able to get vaccinated once they are released from isolation and all their symptoms are gone. They do not have to wait any amount of time before they get vaccinated if these conditions are met. The same goes for any adult that has not yet had their booster dose. Regardless of whether you had a COVID infection, you should get your booster dose to increase your immune response and help improve your protection against COVID-19. I would like to thank the team that has been working diligently over the past several weeks to enter vaccination records. In order to expedite delivery of COVID-19 booster doses, we had to increase the number of clinics using paper documentation, and all of these paper records had to be entered manually into the electronic medical record system. As of Monday, all vaccination records have been entered in the system, so we can have a more current picture of vaccination uptake. If you still do not see your booster dose in your online vaccination record, please contact your vaccine provider. To date, the province has administered almost 290,000 booster doses, as well as third and fourth doses for people who are immunocompromised. We need this amazing feat to grow. As restrictions ease, regional health authorities are reporting decreased uptake for second dose and booster appointments. I strongly encourage everybody eligible to get their booster dose. Vaccinations are a crucial part of living with COVID-19. As restrictions ease, more people of all ages will be exposed to COVID, and we need everyone eligible for their vaccinations to make the time, especially those over the age of 50 who may be at a higher risk for severe illness from COVID-19. Once again, even if you've had COVID, the vaccine will improve your immunity and reduce the risk of severe disease. This past Monday marked a significant milestone in our reopening plan with the removal of border controls and travel restrictions. When we were faced with the original COVID, Alpha and Delta strains, the travel restrictions were a key tool in keeping our prevalence low. The restrictions also required the support of many partners. Over the last 2 years, staff across a wide range of organizations were reassigned from their regular duties to manage travel into the province. These include staff in health and community services, fisheries, forestry and agriculture, regional health authorities, the Newfoundland and Labrador Centre for Health Information, Statistics Canada, Marine Atlantic, airports and port authorities, and private security companies such as Garda World and Commissionaires. I also want to acknowledge the incredible support we receive from businesses and organizations across the province in facilitating travel restrictions, especially the RNC and RCMP, Canadian Border Services Agency, the Canadian Red Cross, the Association for New Canadians, and many other community-based organizations, education and post-secondary institutions, vessel operators and agents, and employers in industries such as oil and gas and mining. Thank you all for taking on this important work. It was no doubt challenging, but it was certainly one of the main reasons our province fared so well for so long. And we are just under 2 weeks away from lifting all special measures orders. We should not expect that life will instantly return to how it was in 2019. This will be a new normal. We have been changed by COVID. We know so much more now, and gone are the days of toughing it out and going to work with a cold. We all need to stay home when we are sick, get tested if directed, and follow self-isolation guidance. You may still require some form of isolation and/or testing if you are a close contact of someone with COVID-19, depending on whether you live with the person, if you have symptoms, and your vaccination status. If you are infected with COVID-19, you will still need to isolate based on your vaccination status until your symptoms are improving. We need to continue following good hygiene practices by covering our coughs and sneezes and washing our hands often and well. We also need to wear masks when out in public, not because it's required, but because it's the right thing to do, to protect yourself and others. Although the provincial mask mandate will no longer be in effect come March 14th, it will still be required in some places, such as healthcare centres. Many businesses, organizations may continue to require masking to protect their clientele. We have had discussions with the Department of Education and school districts regarding masks in school, and to help realize our goal of keeping children in school as much as possible, masking will remain in place in schools until Easter break. We will reassess closer to that time to determine if we will continue with masking after that date. Regardless, we will always respect someone's choice to wear a mask. Most importantly, we need to remember that this is a major adjustment for society, and everyone is moving at their own pace. We need to remain patient and respectful of individual circumstances and choices. Lifting provincial restrictions does not mean the end of COVID. Public health will always be here, monitoring COVID and adapting recommendations when necessary. For the last 2 years, you have relied on public health restrictions to guide your actions. Going forward, public health will rely on you to stay informed and follow current guidance. There's a lot happening in the world right now, and the flow of information can be overwhelming. We will all need positive thinking to help us get through this, and I know for some, positive thoughts will not be enough. So please do not be afraid to reach out for help if you are experiencing worry, sadness, or hopelessness. Please visit bridgethegap.ca to access age-appropriate programs and services that are available locally, confidentially, and free. If you are feeling anxious and alone, you can also call the Provincial Warm Line at 1-855-753-2560, 7 days a week from 9 a.m. to midnight, to speak with a trained peer support worker who is there and ready to listen. If you or someone you know are experiencing a mental health crisis, please call the Provincial Mental Health Crisis Line at 1-888-737-4668 to speak with a mental health clinician any time of the day or night. So please take care of yourselves, look out for one another, and hold fast, Newfoundland and Labrador. Thank you.
Thank you, Dr. Fitzgerald. I think I'd like to echo her comments about the support we've received from various sectors, the public sector and the private sector, over the course of these last 2 years. It has been invaluable. Certainly from my own vantage point, I've seen very clearly the flexibility and adaptability of the healthcare sector and indeed the public sector labour force as they have worked together in new ways and developed new relationships and new friends, I think. And I hope that as the good neighbour agreements wind down with the end of COVID, that those friendships and relationships will carry on as a good thing to come out of this pandemic. So with that, I'll hand it over to Nancy to moderate the question and answer period.
Thank you, Minister. Today we have 4 reporters. 2 are in person and 2 are by phone. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions today are from Peter Cowan with the CBC. Please go ahead, Peter, and make your way to the microphone.
A question for Dr. Fitzgerald. When you look at long COVID, people are concerned that as more people get COVID, that we may see more cases of long COVID. When we asked, there doesn't seem to be a provincial strategy to either track it or provide sort of a centralized treatment or a clinic where people can be able to get treatment for this. Why don't we have a strategy to deal with long COVID, considering we are going to see a lot more people getting COVID, and we know that a certain percentage of those are going to develop long COVID?
Do you want me to say that?
What's that? Yeah.
Do you want to say that?
No.
Well, I don't mind.
Okay, go ahead.
With it being a more treatment-orientated question rather than public health, we have had our science table look at long COVID. Quite frankly, in the peer-reviewed literature, there is actually no consensus about what actually long COVID is. There are a variety of opinions, but no hard data. This is a topic the science table are monitoring on a regular basis and are providing updates. As yet, there is no clear consensus about what should be tracked that constitutes the label that has become colloquially known as long COVID. And until our science table can come to a consensus, and I don't think it's just them, I think it's a scientific body internationally, we are somewhat challenged to track something we can't define.
And Dr. Fitzgerald, I want to ask you about the timing of lifting these mandates, especially things like masking. You've said before it's been very effective at preventing the transmission of disease. You've also said that it's a fairly minor inconvenience. Why aren't we keeping that in place, considering our case counts continue to be quite high and considering we are still continuing to see more than one person a day die from COVID?
So what, we still continue to strongly recommend masking. What we're looking at here and what the legislation requires is that, it has to be the least restrictive means possible to prevent to mitigate the public health emergency. And so that's the balance that we're trying to strike here. At this point, given what we know about Omicron and about the severity of the disease, given what we know or what our vaccination rates, that, it's keeping something in place that makes it, the rule of law to do is perhaps not the least restrictive means that you can use to accomplish that feat. And certainly there are other means that we can reduce the risks, such as our policies that we that can be put in place in the RHAs with regard to our vulnerable settings, and in schools to reduce the risk of transmission as we start to see, more cases as we reopen. But we do have to move forward, and in some ways, Omicron is allowing us to do that by, being Omicron and our vaccination rate, I think, both combining to produce a milder disease and to see fewer people admitted to hospital and experience severe symptoms of COVID-19.
Our next questions are from Andrew Waterman with The Telegram. Andrew, please make your way to the mic.
Good morning. I imagine this would be for Dr. Fitzgerald. One of the justifications for ending restrictions is that we need to consider the impact on mental health. We talk a lot about that, and even in the opening remarks. That, of course, has been a consideration this entire time, the impact on the public's mental health. Can you explain now, or why now, if there's anything in particular, like was there any data that you've seen or any conversations you had with organizations that led you to think that perhaps the impact on mental health is maybe outweighing the impact of physical illness?
I think we've known all along that there have been significant impacts on mental health, and I don't think we can ignore that, going through this. But I think we're looking right now. What we're looking at is when Omicron hit initially, we knew that there would be a large number of cases if we didn't do something to control the spread, and that would severely, potentially overwhelm a hospital or health system capacity. And so we had to make sure we were protecting that. But at this point, we know that if we can release measures a little slowly and allow things to reopen slowly, that we'll see less of that impact. But we do know we have a less severe disease, and that's really been the the reason and the motivation behind removing the measures in the next few weeks, and recognizing that mental health impacts have always been there, and I don't know that we're seeing them more so now than we did before, but certainly knowing that they've always been there and wanting to reduce them as soon as we can to the greatest extent we could.
This would be another question for Dr. Fitzgerald, I believe, or actually it could be for Dr. Haggie as well. I spoke with someone from the Canadian Civil Liberties Association yesterday who said, while at certain times it was justified, the government has done a really great job of making people somewhat terrified, and those circumstances have since changed. Now that public health is asking that the responsibility is now on the individual. Is there any plan in place to release specific scientific data with regard to the individual's risk of getting COVID-19 in terms of hospitalization or death or anything like that?
What we have tried to do is position the COVID-19 website as a repository of trusted and trustworthy information. That will continue. We've seen it modified each time there's been a change in the COVID epidemiology or the SMOs, the special measures orders. I think henceforth, this disease seems to have evolved in a direction that has made it much more likely for everybody to get it and much less likely to result in hospitalizations. And certainly our data would support that. And as Dr. Fitzgerald said, our main metric now is hospitalizations and the ability of the healthcare system to cope. In terms of individuals assessing their own risk, I'm not sure that other than the measures that we have discussed and the factors that Dr. Fitzgerald's put out there, there is a kind of risk score that you can get for getting COVID. I believe each of us in turn has said each of us is more than likely to end up getting it. We just can't, from a systems point of view, have everybody get it all at one time, simply because the system would be overwhelmed. The analogy is being drawn now to severe flu, and certainly if you look at the way we manage influenza, there is information out there. There's always been public health information out there about how to avoid influenza. There's been very vigorous campaigns, and the uptake for vaccination has traditionally been abysmal. Maybe that will change. And certainly going forward, it is down to the measures that we've talked about. Hand washing, good sneeze and cough hygiene, staying home if you're sick, and getting the vaccines that will help protect you and reduce your risk. We, from a government point of view, that information is always out there for influenza. It will always be out there for COVID. And at some point, unless there's something else, and we've always seen there's something else with COVID. Unless there's something else, I could see a scenario whereby we release data on COVID cases on a monthly basis, and they're accessible just like the influenza cases are on the website. I think that is probably the most optimistic way of looking at the future. Now, whether COVID-19 or COVID-20 throws us a curveball, who knows? But that's the best we can say at the moment.
Our next questions are from Jody Cook with NTV. Jody, please go ahead.
Hi there. A question for Dr. Fitzgerald. Considering that now we're just a couple of weeks away from all of the restrictions being lifted, I think we can all recognize that might feel jarring for everybody to just sort of navigate life now in a completely different way than we have over the last 2 years. And Dr. Fitzgerald, you mentioned in your preamble that the public should be, reminded that life won't return to normal, even though it might feel like it is. What do you want to remain on top of mind for people as we navigate the days beyond March 14th and trying to, return to life without all of these restrictions?
Thanks, Jody. I think, what we need to look at is that everybody needs to think about, what's my risk? So you have to think about your vaccination status. You have to think about your risk for severe disease. So do you have other illnesses that may make you more prone to severe disease? And then look at any activities that you're going to be taking part in, and what's the risk of that activity? Am I going to be around somebody or am I going to be around a lot of people? Is it going to be indoors? What's the facility that the event's being held in? What's that like? well ventilated. And then make a risk assessment and decide, okay, is the risk high, is the risk lower? And if it's higher, how can I reduce some of that risk? So is that by wearing a mask? And if that is, well, then you wear your mask when you go there. You may not have to avoid situations altogether, although that may have to be a decision that you make, some people make. But, there are lots of questions, I guess, and things that you have to kind of go through for your own risk assessment to decide if you're able to take part in some of those activities. I think on the whole, though, we still, as I've said, strongly recommend masking, especially if you're, going out somewhere where it may be crowded or you are indoors. I think for the, while we still have community transmission, it's certainly reasonable to continue to wear masks in public spaces. And of course, staying home if you're sick is really going to be really important to reduce spread of whatever respiratory disease is on the go. And it could be COVID, it could be others, but certainly, we know that if you're going out when you're unwell, that's when you're going to be most likely to spread the illness. And so we want you to stay home while you're feeling unwell.
Thanks. On rapid antigen tests, I know a few weeks ago the federal government had delivered a number of those to provincial health authorities. What is the likelihood of, once again, getting some of those into the hands of Newfoundlanders and Labradorians for free, beyond what was given to people on the return to school program?
So rapid tests, we've gotten quite a number of rapid tests from the federal government, and we do have plans for them. And certainly, rapid testing has to be used responsibly, and it has to be used in a way that's going to give you the information that you need. So we're other places that have made them widely available. They haven't gotten they haven't really given the answers that were needed, and it wasn't really an efficient or effective use of those tests to just have widespread availability, because these tests are not, they're not just a one-time thing. You need to use them in series, really, to get the best results out of them, which is why we had people do 2 tests before they went back to school, and why now we have you do 2 tests if you have symptoms if you're in school. And it's why we do with our asymptomatic screening for people who work with more vulnerable populations, that they do it on a regular basis. Because doing more than 1 test in a row is really more effective and is more reliable for giving us the answers that we need. So we need to make sure that we're using the tests as responsibly as possible. And so there will be mechanisms in place, I think, to have tests go where they need to be. So for some areas that may be more remote, we may need to make some of those tests more available if people aren't able to get to PCR testing if they need it. And those plans are being looked at and worked out. And of course, we need to have tests available, in instances of outbreaks sometimes. And we need to think about the fall and what's going to be happening in the fall. And so we need to make sure that we have some tests in reserve for possible use in the fall when we see influenza start to circulate and perhaps COVID again.
Our next questions are from Richard Duggan with VOCM. Richard, please go ahead.
Thank you, Nancy. This question is for Dr. Fitzgerald. In your opening remarks, you mentioned in terms of hospitalizations, we're seeing less of a need for certain interventions because of the decreased severity with Omicron. I'm wondering if you can expand on what that means and some of the trends we're seeing in terms of our hospitalizations right now.
Yeah, so what we're seeing, and it's difficult for here because our numbers are small, but certainly the trends that are being seen across the world, across the country, is that people who are ending up in hospital, they're there for a shorter period of time. They tend not to need as drastic interventions. Not to say that people aren't still ending up in ICU, but fewer of them are going on to get ventilated and requiring some of these more invasive measures that have to be put in place. And I'm certainly not an ICU physician, so I'm not going to discuss go into those in too much detail, because I would not that would not be the right thing to do. But we are seeing that that the people who are ending up in hospital, and we have seen that in our own results, that our ICU admissions proportionately are there, and ventilation is lower.
And I think maybe the minister might be best suited to answer this next question. The form for people to report their rapid test results went live last week, I believe. Wondering if we can get an update on what kind of a response we're seeing with that.
As Dr. Fitzgerald slides the number down the table to me, because we discussed this on the way in, 3,393 positive rapid tests have been reported through the portal. However, some of these could be duplicates, so staff are in the process of, as I say, cleaning the data up.
I will now go back through each reporter to see if you have one final question. Peter Callan with the CBC, do you have a final question?
Yes, for Dr. Fitzgerald, about businesses who are busy trying to decide how they're going to operate and what measures they're going to keep in place after the 14th. What would you recommend, especially for businesses where there's some public interaction? Do they need to get rid of the physical distancing markers in lineups, for example? How should businesses, because a lot of times they've been relying on the rules, now what measures should they keep in place?
Yeah, so thanks, Peter. That's a good question. And I think, it does make a difference to the types of interactions that are happening. Obviously, if you're in a room with people that you aren't normally in a room with, and it might be a good idea to keep masking in place, and some of the physical barriers, of course, that have been in place in some businesses would be, I think, still useful to some degree. We are still, learning to live with this, and I think too, for businesses have to consider their employees and to think about what employees may need to feel safe and to feel protected in their workplaces. So those are conversations probably that need to happen as well. But certainly, we would respect any business who wanted to keep measures in place to be able to support their employees and to support people coming into their businesses as well. Thanks.
Andrew Waterman with the Telegram, do you have a final question?
So this would be for Minister Haggie. I've been made aware that there's a problem with the supply of blood collection materials in the province. I'm not sure if you're aware, or I'm assuming you are, but can you explain what you know about that and what the government is doing to address that situation?
Yes, thanks, Andrew. This is not purely a COVID thing, but I think it's related to manufacturing capacity. We emergency blood work. There is a global shortage. The RHAs here have checked their inventory and have between 23 and 48 days of supply in their supply chain. What some of them have done, particularly Eastern Health being the largest, is they have restricted their supply to outside agencies in an attempt to make sure that these are conserved for the RHA patients. And they've also issued an advisory to physicians and nurse practitioners and the like to follow the guidelines of choosing wisely and quality of care NL to minimize repetitive routine blood work until this can be sorted out. For those patients who may be having blood work every 1 or 2 weeks, the question is, does this fit with guidelines, and can these be done once every 1 or 2 months? So we are aware of it, we're monitoring it, and supply chain and shared services are looking at sourcing extra. But it's a global situation, and this is just the provincial flavour of it.
Jody Cook with NTV, do you have a final question?
Last week, the education minister had indicated on attendance rates, we were about 80 to 83% on average for kids in school. Pre-pandemic, it was roughly 90%. So what are your expectations there? Do we think that this might improve in the coming weeks and days, or holding the line, or any thoughts on that?
I think it's difficult to say, absent a crystal ball, but certainly we know that as restrictions lift and as more contacts will happen, that we will likely see more cases. So I would expect that certainly we're going to see the level that we're seeing right now. We may see a slight increase in cases in this age group. But we also have to remember that there are a fair number of children who have had infection and are vaccinated as well, and so they have fairly good immune protection. So it may not be quite as drastic an increase as you would expect just straight from the numbers. So I guess time will tell. It's a little bit difficult to predict, but certainly I think we'll be seeing at least the same number that we're seeing now, and perhaps a little bump up.
Richard Duggan with VOCM, do you have a final question?
Yes, with the transition now to the endemic version of COVID, I'm wondering what's the future of those specialized COVID testing sites throughout the province? Will they eventually be discontinued and testing move to, say, the hospital and clinical settings?
Yes, thank you. We have, over the course of the pandemic, boosted, built up, moved around COVID testing and scaled it back when the demand has dropped. And I think we will have to see how fast that happens, but I would anticipate that at some point in the future, COVID tests would be almost the thing that a physician would arrange on the basis of need or symptoms. That will take some time to get there, but I think realistically speaking, we will have fewer sites open for shorter periods, but we will only do that as the demand winds down, and will not be in a rush. Though they may be the last signs of the pandemic to fade, really, in some respects.
Thank you, everyone. Minister, do you have any final comments for us today?
Thanks very much. Thanks for the questions. I thank everyone for their time, and wish you a safe holiday weekend. But that's not for another week, so I'm getting ahead of myself. Thanks for your time.